We are not a traditional urgent care. We are actually a hospital-based clinic, so we have the association to the hospital, and everything we do goes through the hospital. So if you've been to the hospital, you're in our computer system, and if you've been here, you are in the hospital's computer system. So it integrates well, and it's a nice service for the people of the community. For those that had been to the old urgent care had a lot of open space but not treatable space. This place has sort of consolidated down to a smaller hallway and less wasted space. You come in the front door, we do have an open area for patients to sit on the left. There is a bathroom in the front where we can do our drug screens, do our urinalysis, and a pass-through window now which allows patients to pass it through into the lab area so that they don't have to walk back out into the waiting room with their urine cup. It sort of keeps some continuity of care there. The front desk offers someone for registration. You come in, you can get registered, get your fingerprints screened, and if you were in the system at Preston, you will pop up on our screen. There's a TV, try to make it a little bit more accommodating out there. Then as you come into the rooms where we see people down the hallway, we have an exam room, 2 exam rooms on the right, and to the left we have a lab room that does our labs, urinalysis, drug screens, DOT stuff, flu swabs, most are phlebotomy, and then the second on the left down the hallway is sort of a nurse's area and or a triage room where we could take a patient and get them in the computer system, do a blood pressure, height or weight, and get their background before we pass them on to the provider. And then in the back there's an area for the providers with workspace and some computer equipment, imaging they can see from the hospital, and then an area for me to work as well, and then kind of a nurse's area where they can have lunch, keep their food. They spend 12-hour days here, so the people we work with, we see sometimes more than our family. It is a coordination of, we know who we're working with, and we sort of feed each other and take care of each other and keep each other's sniffles in check, and it makes for a nice work environment. And we hope that translates to our patient care when they see the staff knowing each other and working well together. So it's a pretty good group of people here. I'm blessed to have found this position. You don't realize being in Preston County, I live in Morgantown, and the snow difference or the traffic or the roads, and you have people that come in here and can get something treated here without having to make that trip to Morgantown or Mon General, and if need be we can send them that direction. But it provides a service, an immediate service to the people in the local area where they can come here, we can rule something out. If they're having chest pain, we could send them to the hospital. The hospital can stabilize them, and then if it needs, advanced care, they can send them on down the road. But what it does is it at least lets us address the problem immediately instead of somebody having to wait that 30-45 minutes to get into Morgantown. So I think I'm proud to be a part of the service that we provide here in the county.